Hello everybody, and welcome to Species Specifics. Today we're going to be discussing rats and mice. If you are new to this series, the goal of these lectures is to cover unique diseases of different veterinary species that are specifically mentioned in the ICVA NAVLE study guide. I've also included some diseases that are not specifically mentioned, but may still come up. The focus of these lectures is on disease recognition through images, clinical signs, and diagnostic tests. I have also highlighted key, easily recognizable characteristics in bold. We are going to start by looking at some primarily rat diseases. First, we have rat bite fever. Rats are a natural host of Streptobacillus monoliformis, which is found in their nasopharyngeal flora. This bacterium does not cause disease in rats, but it can cause rat bite fever in humans and mice. If infected, the human or mouse can develop a potentially fatal septicemia. Murine mycoplasmosis is the major component of chronic respiratory disease syndrome in rats. Clinical signs include nasal discharge, dyspnea, and weight loss. Treatment involves antibiotics to help alleviate clinical signs, but it's important to note that antibiotics are unlikely to actually clear the infection. Some rat owners may also find that nebulization of saline and bronchodilators are helpful for reducing the rat's clinical signs. Ulcerative dermatitis is caused by Staphylococcus aureus. It usually results from self-trauma associated with fur mite infections or inflamed salivary glands. You will be able to see ulcerated skin in the commonly scratched areas where they can scratch with their hind limbs. Treatment involves clipping the toenails of the hind paws and topical antibiotics. Sialodacroadenitis virus is a highly contagious coronavirus. It causes enlarged cervical salivary glands and may also cause rhinitis and ocular lesions. There is currently no treatment available for this virus, but clinical signs should resolve within 30 days. Fibroadenomas of the mammary tissue are the most common subcutaneous tumor in rats. They can occur in both males and females and appear as a mass on the ventrum anywhere from the neck to the inguinal region. Treatment involves surgical removal, and the incidence of these masses can be reduced through spay or neuter procedures. Chronic progressive nephrosis is an age-related disease in rats that may be linked to high-protein diets. Clinical signs include progressive weight loss and PUPD in an old rat. Treatment involves supportive care. Chromodacuria refers to secretions of the Herderian glands that are behind the eyes. These secretions contain porphyrins, which makes the secretion red. Therefore, the major clinical sign is red tears. This condition is not pathologic, but it may indicate a chronic underlying disease or stress in a rat. Now we will look at some primarily mouse diseases. Sendai virus causes acute respiratory infections in mice and is transmitted through aerosol particles. Clinical signs include chattering, respiratory distress, and death. Most adult mice will recover within 2 months unless they develop secondary bacterial infections that complicate the disease. The main fur mite of mice is Myobia musculi. It spreads through direct contact with infected mice or with infested bedding. Clinical signs include generalized alopecia and a greasy coat appearance. Treatment is usually topical ivermectin. The next few diseases primarily affect laboratory mice. Ectromelia virus is also called mousepox. The virus is transmitted through fecal-oral routes and causes facial swelling and rashes. Most significantly, it can also cause sloughing or amputation of the extremities. This condition is most common in laboratory colonies and is generally not treated, and it can be prevented through regular testing of colony members. Epizootic diarrhea of infant mice is a rotavirus that spreads through fecal-oral routes. It causes watery yellow diarrhea in mice under 14 days of age. Again, it is not typically treated and can be prevented through routine testing. Lymphocytic choriomeningitis is caused by an arenavirus that is transmitted in utero or in the early postpartum period. This disease is zoonotic to humans and causes a lymphocytic choriomeningitis, hence the name. Clinical signs in mice may include ascites, emaciation, and death. Finally, for our laboratory diseases, we have mouse hepatitis virus. This is caused by a coronavirus and is also called lethal intestinal virus of infant mice. Most animals are asymptomatic, but you can see white foci throughout the organs at necropsy. Lastly, we have a few diseases that are common in both species. Barbering occurs when group-housed rodents nibble off the fur or whiskers of their cage mates. This is usually related to social dominance within the colony, where the barbered animals are missing hair or whiskers, and a single dominant animal that is performing the barbering retains a normal hair coat. Removing the dominant animal can help in some cases, but generally another dominant animal will take over the barbering. Phylobacterium rodentium was formerly called cilia-associated respiratory bacillus or CAR bacillus. It causes chronic pulmonary disease in rats and mice. Clinical signs include oculonasal discharge, dyspnea, and a hunched posture. Treatment involves antibiotics and supportive care, while prevention focuses on routine testing. Dental malocclusions are common in both mice and rats due to their continually erupting teeth. The incisors are most commonly affected in these species. Overgrown teeth may interfere with normal mouth movement, so the teeth should be cut to an appropriate length to restore normal function. Finally, we have ringtail. This condition primarily occurs in rats, but it can also occur in young mice. It is associated with living in low humidity environments. Clinically, you see a tight band in the tail, often with necrotic tissue distal to the constriction. Treatment involves amputation of the tail just before the constriction. Thank you for watching Species Specifics. If you enjoyed this video, remember to like, subscribe, and to share with your classmates. If you're feeling generous, there is also a link in the description where you can buy me a coffee to help fuel future video making. Thanks again for watching, and we will see you in the next video.